Hello, good morning, afternoon, or evening, depending on where you're joining us from. My name is Wayne Musabayana, and we're reaching out to you from the African Union headquarters in Addis Ababa for this weekly press conference of the Africa Centers for Disease Control and Prevention, Africa CDC, where we have the director of that institution, Dr. John Nkengasong, who is going to be updating us on the COVID-19 situation and the Africa CDC continental response activities across the 55 member states of the African Union. He will also talk about the public health measures that we all need to undertake, especially during this holiday period, and also especially in the light of the increase in cases across the continent. The third point that he will touch on are the joint continental efforts that are being led by the African Union envoys and the Africa CDC to begin immunization on the continent of Africa. Now, you can, as usual, follow this briefing in the 3 languages, and those are English and French, as well as Portuguese. And you're quite free to access your preferred language using the globe icon at the bottom of this Zoom screen. You can also follow us live on other African Union channels in case you're having some sound issues. So you can follow us on the Africa CDC Facebook, which will be streaming in English and in French. You can also follow the Africa CDC YouTube channel, as well as the African Union live stream channel. After Dr. John has given us his briefing for today, we will then go into our usual question and answer session. And as usual, our WhatsApp number for you to send your questions to is +251 945 502 310. Let me give that to you again. +251 945 502 310. Please do not forget to include your name and the institution that you represent. Alternatively, you can raise your hand using the raise hand icon so that you can ask your question live on this program. And the third alternative that you have, as usual, is to write in your question using the question and answer section at the bottom of your screen. It is now time for me to invite our host, Dr. John Nkengasong, for his briefing for this week. Dr. John, good morning, and you have the floor.
Good morning, Wayne, and greetings to everybody. First of all, let me start by wishing all of you, and all of us, a very happy new year. We are a few hours into 2021, and I think we need to look back at 2020 with a lot of look at the challenges that we faced in 2020, but project a sense of optimism in 2021 as we continue to battle this pandemic. And I really like to, at this point, thank the media for your very strong collaboration and partnership that we have really worked with you over the last 12 months in informing the public, holding each other accountable, and actually tracing the trajectory and asking the hard questions as we drive this, we strive to fight this pandemic. Let me, as usual, do the following. I'll give you an epidemiological update of the COVID-19 situation in Africa, and then we'll discuss issues related to testing, and end up with vaccines, where we are with our efforts to secure vaccines for the continent. So as of 9 a.m. East African time today, about 80 million people have been infected globally with the COVID-19 virus. And of that number, unfortunately, 1.7 million people have died across the world. In Africa, as a continent of 55 member states, we have recorded 2.7 million infections. Of that number, very fortunately, 2.2 million have recovered, representing a recovery rate of 84%. Unfortunately, 64,000 Africans have died as of today, cumulatively as of today, representing a case fatality ratio of 2.4%. And that amount, that is the numbers, 64,000 represents about 3.8% of the global deaths due to COVID-19 in the world. 5 countries that are accounting for about 70% of the infections across the continent of Africa include South Africa, that has reached a milestone, a threshold of 1 million infections. To be very specific, as of today, South Africa has recorded a cumulative number of 1,039,000 cases, representing 38% of the cases in Africa. Morocco has recorded a cumulative number of 437,000 cases, representing 16%. Egypt, 137,000 cases, representing 5%. Tunisia, very similarly, 136,000, 5%, and Ethiopia, 123,000, about 5%. When we look at the comparison, the shift, what we call the trends, between last week and this week, we noticed that we have recorded 154,000 new cases of COVID-19 since last week. And we've also recorded 3,500 new deaths since last week when we met on the 21st. So that number, that is the number of new cases, represents an increase of 18.9% increase since last week. And the deaths have increased by 26% since last week. The 5 countries reporting the highest number of new cases include South Africa with 82,000 new cases, Morocco 14,000 new cases, Tunisia 11,000 new cases, Egypt 6,000 new cases, and Nigeria 5,000 new cases. When we now look at the past 4 weeks and we ask ourselves the question, what is the trend, the changes there over that period there? We notice that there have been an increase of 14%, an average increase of 14% during that period. That is the period ranging between November 30th and December 27th. On average, if we look at the 5 regions, again, Africa is not a monolith, so we have changes by region. We have a 16% increase in number of new cases in Central Africa, 11% decrease in East Africa, again, decrease in East Africa, a 4% decrease in North Africa, 42% increase in Southern Africa, and 33% increase in Western Africa. So at least 2 of our regions, global, if you dump them together, that is the East Africa and North Africa, we continue to see some decreases over the last 4 weeks. If you look at the last 4 weeks with our most populous countries on the continent, individually, Nigeria has recorded an increase of over 60% over the last 4 weeks. Ethiopia has recorded a 6% decrease, average decrease over the last 4 weeks. Egypt, a 31% increase over the last 4 weeks. DRC, an increase of 28%. South Africa, an increase of 48%, and Kenya, a decrease of 29%. In terms of deaths, Nigeria has recorded a 49% average increase in number of deaths. Ethiopia, 16% average decrease in number of deaths. Egypt, 8% average increase. DRC, more than a 400% increase. South Africa, 2% average increase, and Kenya, a 32% average decrease in number of deaths. When we now look at the number of testing, as a continent, we have reported a cumulative number of 25.5 million tests conducted, and that represents an average increase of 3.6% compared to last week. The 10 countries that continue to do the most testing, that is 70% of the testing, include South Africa, Morocco, Ethiopia, Egypt, Kenya, Ghana, Nigeria, Rwanda, Uganda, and Cameroon. This past week, the Global Affairs Canada supplied us with an additional 104,000 antigen tests, which we are distributing to our member states. That will really help us to scale up the testing. And Africa CDC has now trained over 676 laboratory experts from 11 countries on how to use these antigen tests. Again, if you recall, we are in a mass rollout of the testing for antigen. Let me just conclude with the vaccines. The task force that President Ramaphosa, in his capacity as the rotating chair of the African Union, put in place, called the African Vaccine Acquisition Task Team, is busy at work. We are in discussions with multiple partners, including other bilaterals as well. We are in discussions with Johnson & Johnson. We are in discussion with the Serum Institute in India. The task force is in discussions with Pfizer so far. So very promising discussions, but not at the point where we can put out any numbers now. I think we have remained hopeful that in the new year, we'll continue to work with member states to obtain additional doses of vaccines, in addition to what the continent has been promised to get from the COVID facility. So I think that is important that we continue to work closely with member states. Very importantly is for member states to continue to prepare on how to deliver these vaccines in a timely and rapid fashion. I always say that failure to prepare for these vaccines will be preparing to fail. We should really work closely, and we have issued guidelines that will enable countries to prepare, because the vaccination piece itself will be as challenging as acquiring the vaccines. So we really need to work hand in hand so that as the task force works to acquire the vaccines, countries are ready to deploy them, such that we don't get into that proverbial saying that failure to prepare means preparing to fail. And we hope that international solidarity will prevail, and the countries that have acquired more vaccines will begin to look at their portfolio and redistribute those vaccines so that the continent of Africa have timely access to those vaccines so that we can meet us at a point of need. Our point of need is the second wave, where we see that these escalating numbers, and we really need to use the public health measures that were employed during the first wave together with vaccination in a timely fashion. So any delay in accessing these vaccines will not enable us to reach a point of need. So thank you, Wayne. Let me turn it back to you.
Thank you very much, John, for that very comprehensive briefing on the different issues that you had set out to brief the journalists on. And now, colleagues, we have come to the point where we have your questions that you can put to Dr. John so that he can give you the responses. And let me just repeat the WhatsApp number that you can use for that. It is +251 94 550 2310. Alternatively, you can reach us either live or through questions on this Zoom platform. Now, let's get straight to your questions. The first one that we have is coming from the Portuguese news agency, Lusa, and they have 4 questions, which I'm going to split into batches of 2. So the first one is, what is the state of progress of the arrangements for the start of vaccination for COVID-19 on the African continent? Namely, what percentage of the estimated money needed, that is between 7 and 10 billion, has already been reached? So Lusa wants to know how much of that funding that was estimated at between 7 and 10 billion has already been raised. And the second question, will the vaccine go through a centralized approval process in the Africa CDC, or will it be approved country by country? And also, do you anticipate problems in this regard? So those are the first questions that are coming from the Portuguese news agency, Lusa.
No, thank you. And those are very good questions. So first of all, with respect to the progress with vaccines and vaccination on the continent, he raised two questions. One is the financing, then the procurement, the approval processes. With respect to the financing, we have three financing analogs. One is through the COVID facility, which all of us are aware of. Then the second, which I've said for the last couple of weeks, is that the Afro-Exim Bank, through their governing board, is ready to raise up to $5 billion. Is again, absolutely no discussion. The question is for member states to come together and agree on how to raise additional monies that will enable them to guarantee that the $5 billion. So that is absolutely not a problem. Then the third financing option is through the World Bank mechanism, which we are working with the World Bank very, very closely to make sure that the 12 billion that they announced, a substantial amount of that, and we are projecting also within the range of $4 billion or so can be made available to member states in Africa. But African countries must make that a priority. They must ask for that money, because it's not just a donation. Some of them are grants, some of them are long-term loans. So I think that's what we are doing with respect to that. So then, of course, the fourth, which I must say is domestic financing for member states. Each countries are beginning to raise their own monies locally to enable them to procure vaccines. With respect to approval processes, we have discussed and agreed that we should use regional processes. That is, work closely with the WHO AVARAT system, which is their regulatory body, that is WHO AFRO, and the African Union NEPAD regulatory body, together with Africa CDC, so that we work with the 5 regional economic blocks of the continent using a centralized process. So that countries don't need to go through a country-by-country approval process. That would help fast-track the uptake of vaccines on the continent. So that is what we are doing with respect to that, the vaccine approval and regulatory processes.
Thank you very much. You spoke there about domestic financing. Let me join that up with this question coming from Ralph Kruger. And Ralph is with the German press agency, DPA. And he says Guinea claimed yesterday with the Russian Sputnik V serum. Is that in line with Africa CDC policy?
So if it is a vaccine, a clinical trials, then of course they are doing what they have to do, which is to test the vaccines, and I've not seen the details of that study, which is very different from using the vaccine to vaccinate the population, which again we haven't seen the details of both their efficacy and their safety data. I mean, as we've promised the continent, we are here as your public health agency to make sure that we look through in a very systematic way all vaccines that are being shipped to the continent, so that we can appropriately advise the continent with respect to the safety as well as the efficacy of the vaccine. So we are not privileged to the specific of that clinical trial in Guinea, but we'll be reaching out to them to understand more what is going on with the clinical trial, at what level of the clinical trials they are engaged with. That is it a phase 1, a phase 2, or a phase 3 trial?
Naftali Mwaura with the Xinhua News Agency in Nairobi in Kenya wants to know the specific dates, if you can, on when the COVID-19 vaccines can be expected on the continent. But he goes on further to say, Do you think that countries are prepared for inoculations? That's Naftali from Shinhua in Nairobi.
So thank you. Again, it's a question that is on everybody's mind. The most reliable source of this information will be the COVAX facility. That is a mechanism that has been in place, and member states have signed up to that. We at Africa CDC are not privileged yet to the specific timeline as to when that vaccine will be, the vaccines from COVAX facility will be delivered in country. So I'm sorry, I cannot be more specific on that. With respect to preparedness, absolutely, countries are preparing. You saw the WHO study or assessment that was conducted a few weeks ago and indicated that about 33 or 40% of the countries were ready. That readiness continues, and that is what I said earlier. I said very clearly that countries should take preparedness very seriously and actively use the guidelines that we've put out there to accelerate the preparedness, because failure to prepare is preparing ourselves to fail. This is a virus that has come back with full speed as we speak. The second wave is with us, and the only way that we are going to win this battle against the second wave is a combination of public health measures that we use in fighting the first wave plus vaccinations. So I think it is really a priority that as we start the new year, countries should work closely with partners to strengthen their delivery systems of the vaccines.
Thank you. Let's try and take someone who's coming to us live. And the first one that we have is Peter Fabricius, who I believe is calling from South Africa. Good morning, Peter. Hello, Peter, your microphone is muted. Can you just unmute your microphone?
Can you hear me?
I can hear you now. Please
okay.
Go ahead.
Yeah,
just tell us your age and then your question.
Yeah, okay, it's Peter Fabricius from Daily Maverick. Thank you very much. Can I just ask you, there's been some suggestions that Morocco has already begun vaccinating. If you could confirm that, and is that the first on the continent? The second question is, is Africa basically going to wait for, for example, the AstraZeneca vaccine, simply because of the logistics of delivering, not having to store it at minus whatever, 70 in the case of Pfizer and 20 in the case of Moderna. It seems to be much easier to deploy logistically. Would that be the strategy? And just if I may, a third question, is there any suggestion that malaria countries prone to malaria are in some way more immune to the coronavirus for whatever reason, because of some kind of indirect immunity granted through malaria infection, or because of the drugs or whatever? Thank you.
So thank you, Peter, for those three questions. We know that Morocco and Egypt had been engaged in vaccine trials using the Chinese, working with the Chinese. And we had reached out to them through a note verbal, of course, which is the diplomatic communication channels to share more information with us. So we are expecting, we did that just the last couple of weeks so that we can know more about what is going on in Morocco and Egypt in the spirit of the whole of Africa approach. So we are hoping and expecting to get more information from those two countries. With respect to the Pfizer vaccine and Moderna vis-a-vis the AstraZeneca vaccine, this is our guidance or our thinking from Africa CDC that we should go with whatever vaccines that we have in a combination. We don't believe that any one vaccine will be enough for now or to reach out to the entire population. It needs to be a combination. So what do I mean by that? If we had the Pfizer vaccines, which we are negotiating, we have, as a task force put together by President Ramaphosa, which requires a -70, you could easily see that you can actually begin to introduce those vaccines in capital cities or big cities, centers, where you put vaccination points, and we equip them with -70 deep freezers, and you start vaccinating there, so that we don't wait. We don't have to wait because of that logistics. Our sense is that by the time you get introducing those systems in, say, capital cities or big cities where you have electricity and appropriate logistics, you have other vaccine candidates that will show up, and then you can use that and keep expanding your vaccination. So the point is that we should not really shy away from any logistics concerns for now, but rather be creative as to how we use even the -70s requirements and put in systems, just like we do for the voting booths across capital cities or big cities across the continent. That is our thinking, that is our guidance, so that we do not wait. Clearly, the AstraZeneca vaccine that requires less stringent storage conditions will be great to have. We also believe that come past June or so, the Johnson & Johnson vaccine, which requires a single dose and also requires that we do actually, we store it at less stringent conditions, like 4 to 8 degrees, will allow us to really reach out to the remote areas and begin to overcome some of the issues with respect to the logistics. But for now, let's really have an open mind, acquire the vaccines, start vaccinating at the capital cities or the big cities areas, while waiting for other vaccines to show up. Excuse me. With respect to malaria, it's not known. We really don't have any studies yet. I think we've always said, and there's a perspective that we'll be publishing in Science in the coming weeks, which we clearly state that it's a puzzle of some of this. Is it because of background infections, because of malaria, tuberculosis, and other infections in Africa? We just don't know. So I think those are all areas of research that we need to work on together with our collaborators and centers of excellence to generate good information.
Thank you for that, John. I will link that response to a question coming from Sophie Mkwena of SABC. She also has a question about Morocco starting the vaccination, and for you to share information on that, which you have done. But she also says there are concerns that Africa is not doing enough to ensure that AU member countries have access to the vaccine, and that the continent is likely to be left behind. And she wants you to please give some deadlines as to when we can expect this vaccine. Are there any milestones along the way that we are meeting in terms of getting to that point of having vaccines on the continent?
Yeah, I think, Sophie, those are very genuine concerns. But let me say that what we know, that the continent, through the very able and exceptional leadership of President Cyril Ramaphosa as the rotating chair of the African Union and chairperson of the African Union, Excellency Moussa Faki, they have really been at the fore to advocate for these vaccines and really exercise that appropriate leadership. Let me just walk you back to what early in June, to be very specific, June 24th and 25th, we had a huge meeting where we convened under their leadership about 3,000 participants across the world to discuss the need for the continent to develop, to exercise leadership in vaccines development and access. Following that meeting, you all know that the head of states endorsed a continental strategy. So we have a strategy, which you can go to the Africa CDC website and download that strategy, which is a vaccine strategy for the continent, which has 3 pillars. One is the clinical trials, which we have the CONVAC, where we launched the CONVAC, and we are very actively working with so many sites there to promote clinical trials. The second is the vaccine procurement, which is led by the AVAC, which is the African Vaccine Acquisition Task Team. And then the third, of course, is the preparatory. Those are the 3 pillars of the vaccine strategy. Then you also know that, as indicated earlier on, that the Vaccine Advisory or Acquisition Task Force is actively engaging with bilateral discussion, including the European Union, including discussions with Canada, including those with the pharmaceutical companies to get additional supplies of vaccines. So the concern that you raise is very valid. We should also remember that most rich countries have acquired these vaccines in excess of what they need. And I think that is a question, as I said earlier, is that we don't have to get into a moral dilemma and a moral crisis where these vaccines are all stock in developed world and we in Africa are struggling to have the vaccines. I think that will be a moral dilemma that we will live with for many, many years to come. So I think the continent has been busy, actively working to secure vaccines. With respect to the timeline, I've always maintained that we shouldn't expect to have vaccinations in January, February, but come the second quarter, we expect to see, that is starting from April, we begin to see active vaccination programs going on the continent. That is our timeline that we believe, based on all the logistics that is required to put in place to vaccinate, based on what COVID can deliver in a timely fashion, and also based on our own bilateral discussions that we are having with the pharmaceutical companies. I hope that answers the question.
Thank you, John. The next three questions are related, so I'm going to group them together. The first one is coming from Maggie Fick of Reuters, and she says, my question to Dr. John is, do you have an update on the strain found in Nigeria, whether it's more infectious or dangerous? Do you have any details? So this is one. The second related question is coming from Sophie Mkwena of SABC, and she is saying, do you have any updates on the variant that is found in South Africa? And are there any countries that have experienced a similar trend in Africa? Then the third related question on the issue of variants is coming from Andrew Meldrum. I think Andrew is with AP. And Andrew says, are there any new developments regarding the two variants of COVID-19 that have been identified in Africa, in Nigeria, and South Africa? Is more genome sequencing needed in Africa to track these variants? So I have grouped those three questions together because they're talking more or less about the same thing.
Yes. So let me address the variant issue very broadly, then I can go to some of the specifics. I think that we at the Africa CDC, as you all recall, we had an emergency meeting just 1.5 weeks ago, where we brought all the best minds on the continent through the African Task Force for COVID-19 to discuss the variant issues. And we came out with very clarity of recommendations to member states. First of all, is that these are not new viruses. Okay, these are the same species of the COVID-19, which means that the same public health measures that we are applying to combat COVID-19 and limit transmission or prevent transmission are valid. So in other words, we don't know that any of these variants is more transmissible even when people wear masks or when people social distance. It is clearly data emerging from South Africa suggests that they are dominating this the second wave in South Africa. So it seems to suggest that they are transmitted easily. Okay, I think that is one. I want to say that because, I mean, we also, in that our recommendation, further insisted that there was absolutely no public health rationale to begin to restrict travels and trades, because that would be unnecessary at this point. We need to apply the same measures that we have been applying to move across the borders. That is principally move with it. In other words, if John is going from country Ethiopia to Kenya and has a negative test, there's absolutely no reason why we should be concerned that John brings in a variant, okay, of the South African variant or any other variant there. I think really very basic public health applications must be followed, and we issued our recommendations there. Second is South Africa. We've not, since last week, have any additional updates. In South Africa, we continue as Africa CDC. We'll be working very closely with Tulio, the principal investigator in KwaZulu-Natal, who did the sequencing. As we speak, we are in very active discussions with them to provide them with additional resources so that we can understand the extent of the spread of the virus and actually begin to investigate whether there are certain pathological or clinical outcomes that are related to the virus. But for now, we absolutely know that there is no effect on the ability to diagnose, because if we had any challenges with respect to those mutants to diagnose, we would not have picked them in the first place. So we know that they are associated with the second wave, but we also don't know that they are making people more sicker or people are dying from those strains more than any other strain. I think that is very, very important. The second thing with respect to pathogen genomics is that the more you sequence across the continent, the more you find variants. Okay, clearly, this is the hallmark of the RNA viruses. RNA viruses will mutate because the RNAs are very unstable, and they tend to, as they divide and duplicate, they will create errors, and those errors will lead to some species that will not survive, but some species will survive, and they will create, they become mutant viruses there. So I think we should be very cognizant that this is having new mutants is not going to be a new finding for these viruses there. But the most important thing is whether the mutant viruses affect some principal outcomes, which again only research will determine. Now, where we are most concerned is, are these changes happening at the site where the antibodies bind to the virus and prevent it from infecting cells, and which is the premise for developing vaccines? That we don't know. Okay, we also know that vaccines are developed against the entire protein and not just those specific sites. So again, we remain very optimistic that this may not have effect on any vaccines. But the most important message I want to leave you all is that as we sequence the virus in Africa, you see that the variants are there, the lineages are there, and a lineage is just a line of offsprings of virus that emerging from the ancestral virus. And if they do not lead to any fundamental changes in the way that the virus behave, then they are really just part of a large group of viruses, subspecies there. So again, if we sequence more in Africa, I'm sure we are going to see more variants there. So I'll leave it at that.
All right. Let's come back to the questions from Portuguese news agency, Lusa. And they're asking what progress specific countries to receive the COVID-19 vaccine, particularly under the very demanding refrigeration conditions that some of the vaccines require. And you have already informed us about some of the temperatures that are required for this. So I guess the question is, what have countries, or perhaps what has been done so far to make sure that countries have the capacity to receive those vaccinations?
I think countries are using all kinds of innovations to get prepared. Like we saw very recently in Nigeria, where solar panels are being put in place that can produce and maintain temperatures, because we have to think of deep freezers, connecting them to very stable power sources and make sure so that they enable them a continuous supply of electricity. We saw in Nigeria that they are taking a lead by using innovation, solar panels that can actually enable and maintain stable temperatures there. I believe other countries are using the same technologies. I would not be surprised that people are using other cooling systems, devices that are out there to really enable that you ship them in smaller amounts, but in stable conditions there. So again, it's hard to put a threshold on what level of preparedness have gone into each member state with respect to putting in deep freezers there. But we have a list of those deep freezers, the -70 deep freezers that we available. We will be happy to share with any member state, but we are not recommending any specific one because that will be violating market forces there. But it's very common knowledge. The countries just need to get those minus deep freezers, work with their lab experts, to acquire the appropriate minus deep freezers, and then have a backup power system so that when power fails, they have a continuous supply of electricity to support those minus 70 degrees Celsius deep freezers.
Then we come now to the last question from Lusa, and the first part of that question is asking about the schedule, the times that we expect the vaccination to be in Africa. And I think you have already spoken to that issue. But then they go on to say, does this mean that international cooperation has not worked as desired and that Africa is already at the end of the line? And by that end of the line, I think that they're asking, does this mean that Africa is in trouble?
I think let me say this, and I'm sure that I'm repeating myself, that we remain hopeful that the international cooperation, international solidarity will prevail. And that is absolutely no need and no rationale, especially no moral and ethical rationale for countries to acquire excess doses of vaccines and wait until they vaccinate all their population before Africa has access to that. I think, again, this is the time that we've all talked about for the last 12 months, on the need to work collaboratively, cooperatively to address the pandemic. COVID-19 would not be defeated anywhere in the West world if it still continues in developing countries there. I think that the whole talk of international solidarity and cooperation has to be translated into action now. And I'm sure that the powers to be at much higher levels are looking into this, I believe. And the leadership of our continent is not just waiting. As I've explained, we are approaching this from multiple fronts to at least secure vaccines and begin vaccinations across the continent. The lesson one we have to learn as a continent is to be able to manufacture our own vaccines on the continent in preparation for subsequent pandemics. This same scenario happened in 2009 during the H1N1 pandemic, where Western countries acquired most vaccines. In 2020, we are dealing with the same scenario. So again, when this is all over, we need to sit down as a continent and reflect on our own health security in 3 dimensions. One, in the area of ability to produce diagnostics. Second, in ability to produce vaccines, which is backed by clinical trials. And then thirdly, in the areas of producing drugs. Okay, if we do not focus around these 3 areas, we'll continue to have these discussions over and over, and generations to come will ask the questions as to what we were doing when to protect our continent. Those are only 3 tools that we need to protect and to guarantee the health security of our people. So I would just continue to remain hopeful that 2021 will be that year where we can all celebrate international solidarity and cooperation, that we came together as a people, as human beings, to address issues related to moral issues, because this will easily become a moral catastrophe if we do not come together and as one to address it going forward, especially as early as possible in 2021. And Africa at this point of need. Our point of need is the second wave of the pandemic is here, cannot delay. We need those vaccines and need them now.
Thank you very much, John. The next question is coming from SABC, and it is from Aldrian Sampier. And Aldrian says, what are the risks if African states delay in the inoculation process? And how else can it be fast-tracked?
The risks are significant. First of all, is that we see, you just heard me today at the start saying that our mortality is increasing. That is, the number of people dying is increasing rapidly across the continent. The number of infections is increasing very, very quickly across the continent. And I think that is going to, if we do not have those vaccines early enough, it continue to be a serious health issue. Second is the disruption in our economies. If we do not have vaccines, it becomes a tremendous economic security issue for the continent. As you all know, come this month, next month, January, which is tomorrow, the continent goes into a continental free trade agreement. And implementing that continental free trade agreement will all depend on our ability to beat back this virus, and vaccines are central to this. So vaccines have become a central pillar for our own development for the continent. Absolutely no doubt about that. Then lastly is that if we do not vaccinate quickly, then the virus becomes endemic on the continent, and it becomes extremely difficult to be managing several pandemics. We should never forget that we are currently dealing with an HIV pandemic. Malaria is out there, tuberculosis is out there, and the last thing we need to get is another pandemic like COVID installing itself on the continent on a long-term basis. Those are the challenges and the risks that we face as a continent.
All right. Cara Anna from Associated Press starts by observing that African officials have been discussing vaccine access for weeks or months now with manufacturers and other parties. But what exactly are the issues that are delaying agreements in terms of obtaining vaccines?
So, Cara, there are two principal issues. The one is the availability of the doses. The challenge that we have, that the world has, is really manufacturing enough doses of this vaccine, especially given that most of the doses, the advanced market procurement had occurred. So you need to find additional excess amount of doses where even if you have the money, you can go get it outside of the COVID facility and outside of those vaccines that have been pre-secured by the Western countries. I think that is one. The second is the financing. How do we raise the money, okay, that is required to, to finance those vaccines in a timely fashion? If we truly have to use the whole of Africa approach, which means you leave no country behind. That is why it takes a series of discussions and believe me, we have been in discussions with ministers of health, ministers of finances regularly, at times on weekly basis, just to come to a common place, working with 55 member states to come to a consensus where we can now take it to the Afro-Exim Bank and then sign the deals and begin to get the money flow is one thing. Then if you have the money, you have to have the vaccines. And if you don't have the vaccines and you have the money, you cannot. So it's like a chicken and an egg here. So those are the two challenges that we've been having since for weeks in discussions with both the vaccine manufacturers and the money part.
We have a plea here from Stan Moncho, and Stan says, "Dear team, I'm currently in Juba in South Sudan. Absolutely no wearing masks, no social distancing, etc. May I kindly propose an intervention, perhaps at the AU level, to engage directly with the government? The pain to keep silent exceeds the pain to say something. Please assist so that we avoid the potential future devastation." And that is from Stan Moncho. He doesn't tell us his agency, but I know that he is a regular on this platform.
Yeah, I think that is a very important plea, a plea that I will join in as well. We have, as I told you, and we reported earlier, before the holiday breaks, we made visits to several African countries. And again, what we are observing in South Sudan is common in several African countries. And that is the plea that we are making to the political leadership of our continent, that COVID-19 is not over, that we know how to fight this virus. We fight the virus by masking. We fight the virus by social distancing. We fight the virus by ensuring hand hygiene. We fight the virus by making sure that the community exercise leadership there. The second wave is here, and is here with vengeance. I think we heard the numbers today, an increase of about 18%. I think that is a large increase there. So again, I join you. It's a plea and a strong plea that I've always made on this forum to the leadership of the continent to say, let the people exercise self-discipline and apply those public health measures. The vaccines will not be here anytime soon. Anytime soon, meaning we can only anticipate that vaccines will be here around the second quarter of this year. And that's a long way to go, given that this virus transmits very, very quickly. So again, I agree with you fully. We are in discussions with the leadership of the continent to again continue to exercise the kind of leadership that they exercised in February, by bringing the whole of society and whole of government to apply to make sure that the population cooperates and collaborate with us as much as possible.
Thank you, John. We have a repeat question from, or rather a follow-up question from Ralph Kruger. And he says, what is the main lesson around the pandemic that you have learned in this crazy year of 2020?
That's a very good question indeed. I think that the number one lesson that I've learned with respect to this pandemic in Africa is that cooperation and collaboration and coordination works. I mean, period. I think the leadership of our continent rose up to that challenge, and I can cite you 5 major things that the continent did in the spirit of cooperation, collaboration, and coordination. The partnership to accelerate COVID testing, which we've all discussed on this forum, was critical when it was needed. Second is the unlocking the supply chain management system using the African Medical Supply Platform. Thirdly is the appointment of economic invoices by President Ramaphosa. Fourthly is the joint vaccine strategy, continental vaccine strategy. And then fifthly, the trusted travel platform. Those are all initiatives that require that we work together as a continent to fight this pandemic. I think those are memorable lessons in 2020 as we fought this pandemic. On an international scale, I think the lesson that number one that struck me and struck me hard was the way the need for international solidarity, but also the tendency for countries to protect their individual nations in the face of adversity. I think that also was very, very striking in 2020, and we hope that we can build a new pandemic governance order going forward, because we live in an era of pandemics, and where we are fighting the COVID-19 pandemic today, we will be fighting another pandemic tomorrow, and we need to really come together and ask ourselves the question, how do we get ourselves organized as the world and institute a governance structure that will provide an enabling environment so that we do not get into the mode of protectionism each time that a common disease threat poses a challenge to the world.
Thank you very much, John. I think we are almost at the end of our time. May I just ask you, please, to give us a summary of your main headline points that you want people to remember that summarizes this press briefing?
So thank you, Wayne. I think the couple of key messages here. One is that I really would like to appeal to the continent that we are here at the heart of the second wave, and the same discipline, the same cooperation, and the same political leadership that enable us to fight a spirited fight in the first wave is so much indicated now. I think that is one. Second is that the international community should meet us at a point of need now, which is to enable us get access to those vaccines in a timely fashion that will enable us to fight the second wave of the pandemic, which is again coming in, has already come in with a full vengeance. The third message is really that we as a continent have to continue to own our pandemic by exercising the discipline and at the level of the community. And again, speaking to the issues a colleague referred to in South Sudan, that the pandemic is in the community. Community transmission is vast, and the only way that we can protect ourselves and protect our loved ones is to exercise those public health measures there. The COVID-19 is a reality. It's a reality. It's not just a disease for somebody else or some other countries. It is in Africa. You heard the number of death rates increasing on our continent. And lastly is really that the preparedness for vaccination is key. Failure for our member states to take preparedness actively will be preparing to fail, even when the vaccines becomes available. Africa will be facing a huge challenge of vaccinating a large number of people speedily and reaching all corners of the continent, which we've never done. This will be a historic moment for our continent. And without active preparation, it will continue to be a very, very a big challenge for all of us. And lastly is to wish everyone on this forum a very happy new year, a new year that I believe will be easier on all of us than 2020. I think 2020 was a tough year. I mean, a year that I remember reading the Chinua Achebe book, The Things Fall Apart, where he described a scenario where he said that the year was tough and it could have broken the lion's heart. I think the 2020 was so tough that it could have broken even a lion's heart. So I think we believe going into 2021 that with everybody working collaboratively, exercising global solidarity, we want this year, 2021, to go down in the history of this pandemic, like the year that we turned the corner on this pandemic with access to vaccines, with taking our own self-responsibility to protect ourselves and protect our loved ones. Thank you.
All right. Thank you very much for that summary, John, but I'm afraid that I'm going to have to impose on your time a little bit more just to ask this last minute question that has come in from Della Russell, and it's really a point of clarification, where she says, did you say that Africa could only get the vaccine by the second quarter of 2021? And she says she's asking because Ghana's leadership has announced that they will get the vaccine by the end of the first quarter. So what is the approach at the continental level?
So again, that is a very good question. Whether you get a vaccine at the end of the first quarter or beginning of the second quarter, I think our timelines are not very different. I think you have to think of the logistics. Listen, it is our wish and hope that we start getting the vaccines even in January. And get the vaccination also started. I think there's one thing dropping the vaccines in the capital city of any country. There's another thing distributing the vaccines across the country. So whether Ghana gets the vaccine at the end of first quarter or the timeline that we are projecting, which is the beginning of the second quarter, I think our timelines are very, very aligned.
Okay, thank you very much. Thank you to Dr. John there for being with us for the past 1 hour, informing us about the situation of COVID-19 on the continent, as well as responding to a number of the questions that the media has put forward to him. I have a message here from Lillian Luwaga, who's saying, thank you, Africa CDC, for hosting this weekly press briefing. And she hashtags that stay safe. Thank you very much, Lillian. So it is time for us to part, at least for this year, because this is our last press briefing for 2020. Let me, on behalf of everybody behind the scenes who's been making this program possible, wish you all a very, very happy new year and say that we will be with you again, as usual, at 11 o'clock East African time on Thursday next week, coming to you from the African Union and the Africa CDC. Enjoy your new year.
Bye-bye to everybody.